Interview part 2, asking the question, how does socioeconomic status, SES, affect outcomes for people with emotional and behavioral disorders with Carol Lincoln? Can you please introduce yourself?
Yes, my name is Carol Lincoln, and I worked as a supportive case manager and a crisis counselor in the field of mental health.
Okay, so let's deal with a lower socioeconomic person. How does that status affect their outcome?
Well, when people are low socioeconomic group, they often live in less than optimal conditions, below par housing that's not well kept, and sometimes in neighborhoods that have a high crime rate. And if a person is anxious and they see a crime being committed right outside their window, they are often afraid to go outside. They feel very fearful. They feel very insecure, therefore exacerbating their symptoms. And also, certainly, it is depressing sometimes to look at garbage all over the streets, which is often the norm in a lower socioeconomic neighborhood because of lack of resources, and the neighborhoods aren't very well kept. So a person's living, looking at garbage every day. That's quite depressing, maybe in a small little apartment with the so-called dripping faucet where the landlord doesn't fix anything up. And if they're living with their family is in the same status as they are. So it does also then lead to maybe a lack of knowledge about the client's illness, and a lack of also transportation to go to appointments, just to even go to the grocery store. So it can be quite a struggle for people without a mental illness, but throw in a mental illness and it really does impact their lives in every way. They also don't have, access to maybe support groups because the neighborhood just doesn't support that type of activity, and it does create a lot of problems for that person. If it's a child, sometimes the schools in the lower socioeconomic neighborhoods don't have many resources. Even just material resources are often unavailable in the schools. I think that is improving now, but it's still difficult. And you're sort of in a little microcosm there in a neighborhood that's the lower socioeconomic. You don't have access to people from many other social groups or cultural groups, or maybe to opportunities to take in some maybe just social things such as a concert or a play or even to go to a movie. And so it sets up a whole number of barriers to maybe improving your lot in life, to have better opportunities, to have better access to treatment and support.
Okay, so if a high school student, middle school student is evaluated and has emotional and behavioral disorders, and they do live in a socioeconomically depressed area with a family, as you said, in the same predicament, how available are resources when it comes to insurances, getting therapy, those type of supports that the student could use?
Well, many people living in that situation don't have very good health insurance. They more or less are relegated to very limited choices, and many people who live in that group have access maybe to Medicaid. And the problem with Medicaid is that private practitioners do not accept Medicaid most of the time, and so their only option is to go to a mental health clinic, which tries to do a good job, but they are overwhelmed, they're overloaded, and sometimes the caseloads could be 180 clients that needs to be seen in a month. And the 45-minute therapy session ends up maybe being a 30-minute session. So a client in that situation does not have access to quality health care or mental health care. Also, they oftentimes don't have the knowledge about maybe some groups that are out there and available to the person. Some of the clinics do offer, for instance, a DBT group for people with borderline personality disorder, but that may not be available, to many groups. Um, and also they're living in a neighborhood with transportation issues. So just getting to an appointment, you miss your appointment, then you are sent maybe a letter stating, they may drop you from clinic services because of that. Especially when it comes to a child or a teenager that needs an adult to help them out getting to those appointments. So it does create a barrier to good health care. If you're in a neighborhood, maybe middle class, so to speak, you probably have better health insurance. So you have access maybe to a private therapist who does spend that whole 45 minutes with you and works on issues. Often in some of the mental health clinics, there's a turnover in staff because it is a high stress job and a heavy caseload that many therapists have to deal with daily. And they also have to deal with emergency cases that may come in that are having a crisis that day, not that they need to deal with that crisis right then and there. So therefore, appointments get pushed off. So it is a big barrier to having good mental health therapy.
Okay, delinquency is a part of preteens and young adolescents' lives when they, have outbursts of aggression. They start hanging around with so-called the wrong crowd and living in neighborhoods sometimes where criminal activity is happening. And it usually will be kids around 13 start skipping school, stealing, lying, using drugs and drinking. Do you feel that young adolescents who live in lower socioeconomic neighborhoods have a less chance of having a better outcome in life than, say, the same teen or young adolescent living in a middle to upper class neighborhood with a family in that area?
Yes, I do feel it impacts their lives greatly. They're living in a neighborhood that, like I addressed previously, that may not be very attractive to live in just by the state of the housing in the neighborhood. Maybe garbage isn't picked up on time. And education may not be the priority, so a child isn't encouraged to get the education. Their peers are probably in the same predicament they're in. Sometimes the family, maybe the mom works a full-time job and has to take a bus for an hour or two in the morning, an hour or two at night, has difficulty providing a meal because she is out there working. Many single mothers are in this situation and living in these neighborhoods, also probably single fathers. And maybe both parents are working low-paying jobs. They can't afford to give their children maybe just the essentials, food on the table. So it is more difficult. The children don't have access to activities. It costs quite a bit of money for a child to play hockey, be on a team. They don't have money to buy equipment. There's a lack of support. The parents themselves are struggling just to get by. And sometimes the parents themselves may be suffering from a mental illness or a drug addiction. So therefore, the child sometimes is left on its own. They fend for itself, and that what happens then is sometimes they will hook up with maybe some gang groups out there to have a sense of family, a sense of belongingness. They don't have that in the school system because if they're going to a school system where children are nurtured in their home, these children just don't feel that they fit in. And then plus on top of that, if they're suffering from a mental illness and they're having behavioral outbursts, they definitely feel they don't fit in. And they feel very angry about their state in life and sometimes have a sense of hopelessness about their life. What are they ever going to be? What can they accomplish? So it is a huge barrier.
Okay, so our last little topic here in this topic is a juxtaposition of a student in a middle or upper class family who is a student with EBD. Of course, his or her life is still challenging, educationally, socially, employment, and things like that. But what do you see a student living in middle or upper class outcome? How do you see their outcomes being a little bit different than a student who lives in a socioeconomic area?
Well, from experience and on the job, a child that I once saw in a crisis situation was seen in an emergency department. He had parents that were middle class. They were professionals. They were very caring. They were right there, right on the spot, holding that child's hand, giving support, and made sure that child had the best care that they could afford in the mental health system. And as far as a therapist and a psychiatrist was concerned, they went out of their way to make sure that this child had social activities, and probably this child was encouraged to do the best he could, and was helped with his homework at night, and helped to assimilate into the community or fit in. A child in a lower socioeconomic group may have, like I said before, parents that are stressed out themselves either by drug addiction or mental illness, or they're working maybe a couple of jobs that are low paying. They're not there can't be there for their child. They don't have the resources to be there. Sometimes they can't get off work to take that child to an appointment, hold that child's hand. So I see that, children sometimes in lower socioeconomic situations are nurtured very well by their parents, but sometimes the parents are just not able to do that. Where in the middle class group or a higher socioeconomic group, there's less stress in the family because they don't have to worry about where their next meal is coming from. And they can feel more relaxed, more comfortable with their child. They may educate themselves in child rearing, parenting, and they're more available to their children. They have maybe paid time off. They may are in a situation that they can be there for their child when they're having an emotional crisis, which is quite important. And they're there to promote socialization and maybe activities. They can afford their child to buy equipment for their child if they want to do a sport in school or take a musical instrument. So it does, and they also expose their children to probably different cultural opportunities. So all of that lends itself to a child who is more well-adjusted and has that secure support system in their background. That's not to say that children in a higher socioeconomic area do not sometimes commit suicide or do not ever are ever able to maybe accomplish what we call a normal life. Maybe that is true. And a child in a lower socioeconomic group does not succeed, because children do sometimes succeed in spite of all of those barriers. So it is, can be for either one that a child will succeed when they don't live in a good environment or a negative environment, but a child living in an environment where they're given nurturance sometimes also doesn't what we call succeed.
Okay, thank you. So, as we've heard in this interview, and then some reading that I've done, that a high percentage of students who come from lower socioeconomic neighborhoods and backgrounds, and also a higher rate of African American boys are diagnosed with EBD. Unfortunately, their outcomes may not be as bright as students who live in districts with better schooling and middle or upper class socioeconomic neighborhoods. So there's definitely a difference and an effect because of a student's socioeconomic status. Thank you.
Well.